Well, major events canceled, dining and restaurants forbidden, public parks and beaches closed. The list goes on and on. But are we still not doing enough to prevent the spread of the coronavirus? We are joined this midday by the president and CEO of Scripps Health, Chris Van Gorder. Mr. Van Gorder, pleasure to have you with us.
Thank you very much.
And you have recently issued a statement saying that no, we are not doing enough. We need to do more.
Well, I think this county, the city, has done a tremendous job up to now. I think we were well ahead of New York and other parts of the state of California. But there are still unnecessary businesses that are open. I hate to say that because I worry about the economy as well. But we really need to be sheltering at home even more than we're doing today. I even got a traffic alert on Friday as I was in Kearney Mesa area. So many people were out and about. This is a highly infectious disease. If people are at home, they're going to be safe. If they're out in the public, they have a potential of getting infected. And if our projections come true like they are in New York, we could overwhelm the healthcare delivery system fairly easily if we do not follow the flattening of curve guidelines that have been set out.
I know that you've looked at your own hospitals in that way. Is Scripps in a position to be overwhelmed by this?
Well, I think all of our healthcare systems are. At this point, we have stopped all of our elective procedures and our visits. So we've opened up an enormous amount of capacity. Normally, we would have in any particular day more than 800 patients, maybe 900 patients in our 1,200 beds. And right now, we have capacity for about 600 more patients. So we're about, just a little bit around 50% full. And we've just developed plans to actually go even 40% more than that if we needed to surge with additional patients. But with the shortage of personal protective equipment, PPE, ventilators that would be necessary in this type of situation, it wouldn't be that hard to overwhelm our healthcare delivery system. Again, we're preparing. The work that's being done, flattening the curve, is really, really important. I just want to make sure that people really are heeding that because, as I said, complacency at this point could kill.
I know you've also called for a reevaluation of those companies that are considered essential. Are there some that come to mind that you think, okay, these are still operating, but we don't need them right now?
Well, I'll just give one at Scripps, for example. We have a parking structure that's under construction at Scripps La Jolla. And while we certainly want to get that facility completed, a delay of a month or two would not hurt us in the greater scheme of things. So I'd rather see all of those workers at home, not out in the public. And I think there's a lot of businesses like that.
Well, you're a man in your position that understands the importance of people having jobs and the economy being healthy. And you probably heard the debate. Is the cure going to be worse than, everything else here? Because if the economy goes completely flat and people are out of work, that will have its own health cost as well. Where do you come down on that?
Well, just look at New York right now. I think had they started sheltering in place even earlier, they might have been avoiding what they're seeing now and basically a complete shutdown. I mean, when the president's talking about quarantining a city like New York, and I'm glad he didn't do that, but you can tell how significant that is. What I'm hoping for is if we do it now, we prevent the overwhelming of the healthcare delivery system, we'll actually protect the economy long term.
Mr. Van Gorder, it's been a pleasure to talk to you. I just have one last question. I know you were once a police officer. Can you imagine being on the beat during a situation like this?
Our first responders are out there right now doing their job. I still work with the Sheriff's Department today. These are heroes that are out there. Our healthcare workers right now that are ready to take care of anybody that comes to see them, and our first responders are doing their job as they always have done and always will do. Proud of them all.
Chris Van Gorder, President and CEO of Scripps Health, thank you so much for your time today.
Thank you, sir.